Hey guys, my name's Garston and I have a ruptured patella tendon. Um, I am going to be kind of documenting my entire process through surgery and recovery. Um, and the reason I'm doing this is because when I started looking for things to expect and whatnot, there wasn't like a ton of resources available from people's firsthand experiences. There were a couple, which I'll give credit to in the text of this video, but mostly it was just like kind of surgeon's instructions about how to take care of yourself afterwards. So I just wanted to hopefully do this to help anyone that might have the same injury that I did. So just to give you a little bit of a background of what happened with my injury, I was playing basketball, and if you can imagine, like these were my legs, let's say, I started driving to the basket, I jumped, and when I did, I kind of was pushed a little bit, not like very much, but just a little bit, just normal basketball contact, and I slipped. So my legs kind of went, you know, parallel to the floor. And when I came down, if these were my knees, they just came in at a really weird angle. And it was my left leg. And as soon as I hit the ground, I knew something was wrong. It wasn't necessarily like a blinding pain, but I could totally tell I did something weird. I looked down, my kneecap was completely in the wrong spot, like it had detached from um, the rest of my knee. My leg was bent at that time. Instinctively, I kind of just pushed my knee down and straightened my leg. And if anything, I think it felt a little bit numb at that point. But after that, I knew I had done something wrong. I got carried off the court. I iced it a little bit. And from there, I couldn't lift my leg up, couldn't bend it at all. So I knew this was a serious injury and not just maybe like a sprain. I couldn't put really any kind of bend in it or anything like that. I was in Austin, Texas at the time. I live in LA, and so that was a challenge to travel the very next day back to LA. It was kind of fun to be wheeled around everywhere in a wheelchair, but definitely not ideal to get a major injury like that and then have to travel the next day. So I took a few days to get into the doctor's office. The reason being I had already scheduled an appointment with my general doctor for just an annual physical, and it was on a Friday. I came back on a Monday. So I said, okay, I'll just wait a few days. When I got in there, I asked for an MRI. My doctor ordered one. And in the meantime, I've been on crutches that entire time that I got at a Walmart actually in Texas. So I went to the doctor, got the MRI done. A couple days later, find out the MRI is back. They say, hey, you have a ruptured patella tendon, like completely ruptured. There's no partial part of the tendon holding together. So went to see the ortho. The ortho said, hey, you need surgery. I booked the surgery, and my surgery is tomorrow. So it's been over 2 weeks now since I actually got the injury. And the last 2 weeks have just kind of been wasted time, I think. I haven't been able to really do much. Still haven't been able to bend the leg. The swelling's kind of gone down, but no improvement. Haven't been working to improvement. So that's why I'm kind of excited just to get the surgery done. Now, my surgery works where they're going to just drill some holes in the kneecap, suture up the tendon back into the kneecap, and the scar is going to be pretty big. Like the scar they said it's going to be 6 inches or so long, so it'll be a nice little battle scar. But I'm just happy to be on the way to recover and whatnot. Some things that I've done to prepare the last few days is I've loaded up my pantry with a lot of anti-inflammatory type foods and supplements. So stuff like, turmeric and ginger and, a lot of organic vegetables. I plan to really, load myself up with as many good nutrients, plant-based things as possible. So a big thing for me also the last couple days has just been, doing meal prep and stuff like that. I'm assuming I'm not gonna want to walk around a lot at the time. I think it's important to at least get up sometimes to help with potential blood clots and stuff like that. But yeah, just meal prepping, making sure everything is set ahead of time. I bought myself like an automatic icing machine, which I read online would be a game changer. Essentially, it just works at like you just have this. It's right. I have it right here, and I can show you guys later. But just kind of like a cooler. You put some ice or frozen water bottles is a tip that I learned, and attached to it is like a little kind of hose that hooks up to like a knee pad, and you can just leave it on your knee, and the ice cold water will kind of just rotate around your knee constantly, so you're not having to get up, cycle through ice packs all the time. So I think that's a game changer. My poor friend and roommate is gonna have to be on duty in case I need anything for a little bit, but I think I'm as prepared as I can be. I would like to think I have a pretty high pain tolerance, but we're just gonna see how this works out. I have read that it's gonna be a lot of pain when the anesthesia wears off, and even when you take your painkillers, the pain's gonna be excruciating for a couple days, but I will let you guys know exactly what my experience is. I'm going to check back in right before my surgery, but I just wanted to introduce myself and let you guys know I'll be going on this journey, the good, the bad, the ugly. I'm not gonna leave anything out. So I hope this helps anybody at some point, and I will talk to you guys later.